Hi guys, my name's Kim. I'm going to be making a video today about how to identify different parasites and how to treat them. So the first one I'm going to talk to you about is crypto. Cryptocarrion is itch, white spot, in simple terms. What is it? It is a protozoan parasite. Its diameter is 0.5 millimeters to 2.0 millimeters, so it varies in size depending on what strain. The treatment is copper for 4 weeks and leaving your tank fallow for 12. What it looks like is individual white spots. It is large. The spots are larger than most other parasites that can be confused for itch, but generally, if it is an individual spot on the fish, as in you can distinctly see an individual white spot on the fish, it is itch. Most definitely, it just varies in size and how it affects the fish depending on the strain. How do you prevent itch from getting into your display tank? Quarantining fish. Itch is one of those diseases that needs a fish to survive. It needs a host. How can it be introduced to your tank? It can be introduced by live rock, mollusks, coral, invertebrates, or if you use collected seawater, it can come in that as well, and it can come on your fish too. How do you quarantine for it and how do you prevent it? So the best way to prevent it is when you get new coral dip them. Use a coral dip. I use this one, which is by Continuum. You leave it in the, you do 4 liters of water and you leave the coral in there for 15 minutes, and then you get clean salt water and you dip the coral into that and wash all the coral dip off, and you'll see all the little parasites and the pests that come in the coral or in a live rock come out of it. Brittle worms is another one that comes out. It kills. You can't dip invertebrates, you can't dip mollusks, you can't dip clams, you can't dip anemones. All of those you have to quarantine in a tank, in a fallow tank, for 3 months. Fish, you quarantine in a quarantine tank with copper for 4 weeks, and then before you put it into your display tank. If you get white spot in your display tank, take all the fish out, leave the tank fallow for 12 weeks and treat the fish with copper for 4. Next one I'm going to talk to you about is amyludinium. Marine velvet. So udinium for short. What is it? It is a single-celled organism. It is a dinoflagellate. Pretty crazy, huh? Udinium is the only dinoflagellate that can cause disease and infect your fish. Symptoms usually involve the skin and the lungs. Mild will usually only infect the lungs. More severe will infect the gills and the lungs. And it will cause the gills and the lungs to become inflamed and bleed, and the lung tissue will die. Fish will show signs of struggling to breathe, lethargy, being lethargic, and rapid breathing, gasping at the surface. What does it look like? It looks like small gold spots. It's actually gold. Yeah. And what it does is it creates a velvet shimmer across the fish's body. Once it becomes that gold shimmer across the fish's body, it's already infected its gills and its lungs, because that is the first place that it infects. And once it gets to that point, it is generally too late. How do you tell early signs? So how do you get it early? So the best way that I figured out personally to do it is turn all the lights off in your tank in the room and get a torch, like with a blue light in it, and shine that torch over the fins and the dorsal area of the fish, and generally they will show up quite distinctly. How do you treat it? Copper treats it. So you can avoid it by quarantining properly with copper. It's just that simple. It has the same life cycle as white spot. It has a fallow period. It dies. It needs a host. Brooklinella. Brooklinella is another ciliated protozoan parasite. Behavior: fish demonstrate to be lethargic, toy with their food, spitting it out. Respiration becomes difficult as gills become heavily infected. There is no known treatment. There is no known sure treatment. There is arguments across the industry on whether or not copper does treat it. In my experience, it doesn't. But some people it might work, some people it might not. It's a weird one like that. There's no literature about it really. There's not a lot known about Brooklinella. It's or how to treat it. So it's just sort of, when you get it, all I can say is you're screwed. Good luck. Now, moving on to the next one. Euronymma marinum. Now, as a lot of you know, I have fought Euronymma marinum recently. What is it? Well, the parasite behind the disease is a ciliated protozoan parasite. Similar to white spot, similar to Brooks. The only thing that is different about Euronymma marinum to the others is that it lives freely in a marine environment. It does not need a host to survive. Euronymma usually feeds on bacteria, but will attack fish when weak. When it attacks a fish, it eats all its internal organisms and all its muscles. Symptoms include rapid breathing, flushing, loss of colour, as well as fast weight loss and red sores and dehydration. Treatments: people say copper, it does not treat it. Do not listen to the people that say copper. It doesn't work. Trust me, it doesn't work. Metronidazole, formalin, freshwater dipping helps, but honestly, if you have Euronymma marinum, go in with metronidazole. It is much faster and it works. I proved it. It works. Once you've gotten all your fish out of the tank and all your coral and your invertebrates, you need to move them all to a quarantine tank. Then you need to sterilize your entire tank. Empty it out, bleach everything in it, including the tank, including the skimmer, including the pumps, including the heater. Everything needs to be bleached and then thoroughly rinsed. Because like I said, it does not need a host, because it mainly feeds off bacteria. Now, the next one I'm going to talk to you about is Gyrodactylus flukes. Gyrodactylus is a broad group of parasites commonly called body flukes, gill flukes. Gyrodactylus belongs to the phylum family, which are flatworms. Behavior is lethargic, swimming will become intermittent as fish will get tired. Breathing at the surface when gills are infected. Fins become clamped, ragged, often small spots of blood on fins. Body will get lesions as well as excessive mucus. Body will get ulcers and cloudy and bulging eyes. The way that you treat it is prasi. Flukes is one of those things that you've got to get onto quickly, but it's fairly easy to identify as it's got symptoms that are distinctly different to other parasites. Now, somebody asked me to talk about algae growth in their tank. How do you prevent algae from growing in your tank? Well, there's a few different ways. Keeping your nutrients lower, so your phosphates and your nitrates helps. If you've got low nitrates and low phosphates, then there's no food for the algae to grow. Excessive light can cause algae to grow, so have your lights on for less. 7 hours is about right. It's about what you need them on for. No more than 7 hours. If it's near a window, put a good blind on the window to block the sunlight out from coming and shining onto the tank. Overfeeding the fish can do it, so cut down on feeding your fish. Not enough water movement can also do it. You can use, there are products out there that will help. Peroxide helps. There's also a Dr. Tim's thing called Waste Away and Clear Up. You can dose that. There are a few different things. You can put your tank into a complete blackout for 48 hours and that will definitely kill it. A foxface, a tang will eat some. I actually have a foxface that eats dinoflagellates, believe it or not. It's pretty neat. He's a good boy. But yeah, so just lawnmower blenny helps as well. Abalone, sea hare, all those things help. But yeah, it's generally caused by too much nutrients in your tank. So your nitrates and your phosphates are too high. So you can lower your nitrates and phosphates by doing regular water changes. 50% every few days to begin with, and then once you got it down to the desired level for a reef tank is about 2 parts per million. For a fish only tank, 10 parts per million is fine. But there's many ways you can lower it. You can do it by doing water changes, you can do it by dosing Nopox or some sort of carbon dosing, vodka, vinegar, Nopox, so on and so forth. The other way you can do it is by setting up a refugium or an algae reactor, or you can run a nitrate and phosphate reactor with sulfur beads and that in there. What else? But that's really about it. It's just about tank maintenance, having enough water flow in your tank, not too much light, not feeding too much, and just keeping up with water changes and keeping the nutrients down. But apart from that, it's generally, you're gonna get algae, so you may as well just have some cleanup crew that will take care of it for you. I believe that every reef tank should have a fox face. Honestly, that's large enough to have a fox face. If you've got a big enough tank to house one, you should have one. For the smaller tanks, have a lawnmower blenny. They're pretty good little grass cutters as well. So that's my opinion on the matter. So yeah. Anyway, I hope this video helps, and I hope that you learn a little bit. If you've got any questions, if I've missed anything, feel free to post a comment below in the comments, and I'll try to answer it as quickly as possible. I hope you all have a really good night or day, wherever you are, and thank you for watching my video. Bye.